Okay, so we have a thumb injury here. Typically the thumb injury is going to hurt like bending backwards, bending this way or bending this way. Any of those hurt for you at the moment?
I mean, for acting's sake, sure.
So we're acting this out here today. So this one hurts, right? And this one hurts here. Pretty typical. And what we're gonna do is we're gonna use some tough skin. So we want to spray it. We're gonna anchor this all within the hand so that he can still have full range of motion for his wrist. All right, so let's come over here. We'll get a little spray and turn over. Sorry, this way. Good. And then, yeah, so we basically have our anchors. This is what most tape jobs on YouTube and that don't really show. So we want to start inside the thumb. We want to come around the back of the hand and maybe like hit piezoform over here. So you can see like we're heading straight across the back of the wrist. As we hit that kind of corner of the hand down here, it deflects the tape up. And we come up through this part and we just want to kind of fold that over, turn the hand down, and then onto the back of the hand, okay? So that's our anchor. And by doing it that way and not anchoring across the wrist, then he's gonna have full range. Yeah, so for all of our sports that enjoy wrist mobility, we kind of love this rather than immobilizing things, just having like a block of a hand that we can push things with. So once we have that there, we need a little bit of anchor up in here as well. We're gonna do half strips and just kind of wind that around here gently. You know, this doesn't need any tension at all, right? So we don't want to be like starting to cut his blood flow off just by putting our anchors on. Then we start thinking about our functional tape strips. And this is where you can have some slight variation in the location of them, depending on what you're trying to restrict, right? So we want to restrict coming this way, we want to restrict coming this way. And so this is all happening around this joint right here. Yeah, feel free to come in a little closer if you want to be able to kind of get in and see that. So, so when we're coming around to prevent this from going backwards, we're going to want to come in this way. First, we want to just put the tape onto the back of the hand. So that part is sort of laid down. That's not really going to do much, but it's securing the tape. Now we're onto this part. We're just above the joint and we're coming across into the hand. So you can see if I really pull on it, it's pulling them in, and that's not going to go that way, right? To be functional, can you make your hand like really strong? So this is a position of strength for the hand. Now we've got him in a good position where he's going to actually be able to do stuff. So we can just sort of lay that one down. And then if this is somebody who's just maybe, you know, injured, say 6 months ago and they've been taping every day for practice and it's the tail end, they might just do like 2 of these, but if it's a recent injury, they're gonna do probably like 4, okay? So you can see that one's gonna line up about there. So again, I've got it laid down. There's no tension as I worked around the thumb, so he's got his blood flow still. And now I can decide how much tension I want here. I want you again, like when I'm putting in these tapes on, to be holding your hand nice and strong. Okay, so I've got that one down. And then, yeah, we'll just kind of get a couple more on and show some of the variation. So here, we're going to be trying to come down into more of this angle, right? So we want to come down like that. So this one is going to need to be coming around this way a little bit more. This time, I'm just going to bring that into the back of the hand and I'll finish this one up. So the further, more vertical kind of in a sense, like if you're looking at the hand this way, the more that the tapes start coming this way, the more that it's going to protect against this type of movement, right? But right now we're doing a good job of protecting this way. And some way you can look at these sort of loops, you can think of them sort of like breast cancer ribbons. They're like little, you know, just little loops that are coming around. And so here, now you can see, like I said, it's a bit more like vertical. And this is going to start to restrict that motion there. So once all of that's in place, those are our functional strips. Just gonna put what we call a hood over the top. So we can see he's got a little window in the tape here, and if he's playing a lot, that might start to irritate his skin. If he's got a little window over here, like we wanna see where those are at, and then just kind of close it off. Get that to come around. Good, okay. That's all the functional stuff. And then we just have to finish that anchor, repeating what we did in the beginning. So I'll pinch through there, come onto the back of the hand. I'm gonna go one more round because I've got this area right here. Sometimes this little bit is gonna pop up. It may or may not, depends on the person. So sometimes you're gonna wanna kind of finish it by coming through there, hold all of that down, and then just on the back of the hand and you're done. Okay, so you can generally have your athlete now like squeeze that tape in, right? So this is according to his level of comfort, how much he wants to squeeze and press. And then you can start to look at sport-specific skills that he needs to do, like gripping, throwing, catching, like stabilizing, maybe going to the ground, different things like that he's going to be needed to do. You know, in basketball or ball sports, volleyball, stuff like that, we'll take a ball like off the hand with some impact and try to see how that feels. So he gets to kind of try that out, and like, does it feel robust? Does it feel strong enough that he's confident to go out and do what he needs to do? Also telling him this is going to loosen up. So a fair bit as you get out there and start doing stuff, it's gonna loosen up a lot. So if it feels really stiff right now, don't worry about it. Go try your thing, and come back if if it really is too stiff. We can also do capillary refill here. So if we squeeze the thumb, maybe you want to get it close on that. You can see. So normal, it blanches. 1, 2, 3. If it comes back within 3 seconds, we have no concerns at all. I don't even mind if it looks a little bit purple, as long as it comes back. Yeah, that's all good, right? So that came back real fast, no problem. Okay.